everyone, welcome back to the channel. So today we will be studying the gastroesophageal reflux disease. The gastroesophageal reflux disease also is said to be the GERD. Moving on what it actually is. So as you see, the name itself is comprising of gastro, which means your stomach, and esophagus. Okay, esophageal is here for esophagus. What do you mean by reflux? Something which is moving backwards. So in normal condition, the food travels from esophagus towards the stomach. But in chronic condition, there can be a backflow of the food from the stomach to the esophagus, which can lead to acid, which can lead to a burning sensation, a heartburn kind of sensation in the patient. This is not happening in normal conditions, but in GERD, the gastric acid or the undigested food can move backwards. So why is GERD actually happening? What is the reason behind this GERD? In normal conditions, the junction of the esophagus and stomach comprises of a gastroesophageal junction. Do you get that? At the junction where the esophagus meets the stomach, there is a sphincter kind of thing. There is a junction which is said to be the gastroesophageal sphincter. This junction prevents the backflow of acid, that is HCl, and any kind of undigested food in normal healthy conditions. I will show you in this diagram. This is how food passes from your esophagus to the stomach, and this sphincter here you can see is closed. So in normal condition, this sphincter is usually closed, and it is usually opening only when pressure is applied by the food we eat, right? So you see this is right now closed, and now when the food will come here, it will apply some pressure, sphincter will get open, and the food will enter into the stomach. But in GERD, this sphincter is not either closing properly or sphincter is usually open, which leads to the reflux. The food now has got a chance to reflux back into the esophagus. So this is what happens in GERD. Now moving at what are the risk factors? Who are the people who actually are at risk factors? So very obese people are the ones who are at risk factors. Other than that, if there is any kind of defective esophageal clearance, if the esophagus is not clearing properly, every amount of food is not entering the stomach, can be another reason. Then people suffering from hernia, delayed gastric emptying. For example, if you have indigestion issues and the food is not leaving the gastric area very in normal conditions and it is delayed, so then there are chances of the backflow of the food. Then you see people who are excessive smoking people or alcoholic people are the one who are at high risk. Also, if the intra-abdominal pressure by any means is increased, can be another reason for your GERD. Now moving to the clinical features, what we see in the patient. So when a patient will come to you, these are usually the things the patient will be complaining about, that he is having a heartburn kind of sensation, maybe he is having some acidity kind of sensation. He feels that his area near the heart is burning inside. Okay, that kind of situation is there, and mainly it is seen when the patient is lying down or forward bending. Imagine you just ate something very heavy, very spicy, and then suddenly you lie down or suddenly you forward bend. You can feel it in your own body, that you feel like there is something burning kind of sensation or acid formation. You feel like food is trying to come out. So that is why it is said that whenever you eat, until 3 hours, you should never just eat and lie down, or maybe not do exercise or workout. Otherwise, there are chances of GERD or vomiting. Another thing we see here is water bash. The patient will be complaining of this situation, that is water bash. In this condition, what happens is there is hypersecretion of the saliva. The salivary glands become very, very active, and due to which a lot of saliva is produced, which also helps as a medium for the acid to travel in the oral cavity. For example, this is your oral cavity, this is your esophagus, and there is a lot of fluid inside the oral cavity, a lot of saliva there in the oral cavity. What will happen as the person is having GERD? The acid will try to come in the oral cavity, and now this saliva will act as a medium through which the acid can be supplied to whole of the oral cavity. Next sensation or next kind of problem feature with the patient will be complaining of will be sudden waking up at night. The patient will say that I was sleeping in night, suddenly I felt like a choking sensation in my chest. I felt difficulty in breathing, and suddenly I wake up. It happens to you also sometimes, right? When you eat a very heavy meal or dinner and when you go for a sleep, So suddenly, because of acidity, you feel that there is something very heavy in your chest, and you wake up because you're not able to breathe properly, and that is a kind of choking sensation which can be felt by the patient. Nausea and vomiting, of course, will be there. The patient will every time feel like vomiting. The food is trying to come out. There will be chest pain because the pressure in the chest area is increased. There will be hoarseness of the voice, and there are chances of recurrent chest infections and bronchial asthma which can occur. So these are some of the clinical features that the patient will be telling you about. Next we come to how can you investigate the patients of GERD. So for patients of GERD, you usually refer the upper GI endoscopy. In the upper GI endoscopy, you see in this test what is happening. A thin, very thin tube kind of structure is being passed through the esophagus into the stomach, and through this endoscopy test, the upper GI endoscopy, we can check whether the sphincter is closing properly or not. Now the next thing is the treatment. Now we can divide the treatment into two levels. Primary treatment. Primary treatment is when you are just suggesting the patient to do some lifestyle modification. Like if he is smoking, he should quit smoking. Regular exercise so that the digestion is being maintained. Sit up straight. Do not just lie down when you have your meal. Eat small meals throughout the day. Do not eat something very heavy which is difficult to digest. Chew your food slowly. This is very important. Every time ask your patient or even your family members to chew their food very properly and slowly so that the food is completely broken down into the simplest form and can be easily digested. Then go for triggers or some foods or items which can trigger the heartburn sensation. Do not go for something very spicy or something which causes acidity. Wear loose and comfortable clothes. Sometimes even the tight clothes you wear, the fitted clothes you wear can increase the pressure on the chest area, which can lead to uncomfortable sensation. Now you see, sleep with your head and shoulders propped up. Always it is suggested, we do not follow this usually. Do not use a pillow which is very much flat. Okay, try to use two layers of pillow, which actually keeps your shoulders and your head and shoulders a little above the flat level of the bed. Always minimize the use of caffeine and alcohol. It can lead to acidity. And as I already mentioned, do not try to lie down just as you eat your meal. At least wait for 3 hours above after your meal to lie down. The next and secondary or the medicational treatment we have, you can give drugs like protein pump inhibitors, maybe some H2 blockers and antacids which can be given to the patient. If the patient is not getting to be treated and feeling better with the drugs which you are giving to the patient, you can then go for fundoplication. What is fundoplication? It is basically a surgical procedure through which you can correct GERD, but it has to be taken in consideration only in the severe cases where the medicines are not at all beneficial. Then you can go for fundoplication. The last part of this topic is complications of GERD. For example, there are some patients who think that it's just acidity. Why we have to take medicines for this? Why have to we get this treated? So for those conditions, you need to know that there are GERD complications which can occur if you do not get your GERD treated at right time. So first thing which can happen is esophagitis. What is actually esophagitis? So this is basically infection of the esophagus. So whenever there is infection of esophagus which can occur because of prolonged GERD, that is known as esophagitis. Then you have iron deficiency anemia which can occur. Benign esophageal stricture. Now many of you must be thinking that I have written a wrong spelling. It must be structure and I've written stricture. No, it is actually stricture only. What does this word or this particular complication means is, what happens is that when your when the HCl moves back to the esophagus again and again, it can lead to esophagitis, okay? And this esophagitis or this movement of HCl again and again in the esophagus can lead to scarring of that tissue. A scar tissue would be formed in that area of esophagus, and this is said to be the benign esophageal stricture. Now, in very rare conditions, it is not usually occurring, but if the GERD is being prolonged or left untreated for an extremely long period of time, it can lead to the carcinoma of esophagus, that is the cancer of esophagus.